Hello. So I'm going to just make some videos regarding my experience of getting the MACI knee surgery. I'm basically doing this because I have searched high and low for information and just personal experiences from people who have received the MACI surgery, and it was actually incredibly hard to find. So I'm hoping that that this will help somebody who's going through this just to understand post-op, what it's like, what it feels like. So that's my intention. But anyways, so I am 1 week post-op from the MACI surgery. I had the MACI surgery done in 2 areas, in the patellofemoral joint and the tibiofemoral joint, I believe is the 2 different types, which is basically I had cartilage replaced behind my kneecap and then cartilage replaced on my thigh bone as well. I actually, previous to this, have also had microfracture surgeries on both of my knees back in 2018 and 2019. So I've just had horrible knees for years. I was a runner for a really long time and just bad genetics. So if you're a runner, you're not going to necessarily have these issues, but it's the combination of being a runner and just bad genes with my cartilage, I guess. So back in 2019, when I got my microfracture surgery, at the same time, my surgeon actually harvested my own cartilage, and it's been growing in a lab for the last 4 or 5 years. So this cartilage is my own cartilage. So last week, June 19th, I had this surgery done where they implanted my own cartilage into my knee in both of those areas. The 24 hours after, I was actually doing pretty good in the sense of they had loaded me up with nerve blockers and painkillers. Even before I left, they gave me fentanyl, which, I mean, we all know about the fentanyl, crisis in the country. And so I didn't even know that was something they gave people in a hospital setting. So, before I left, they gave me fentanyl and oxy, and I had a nerve blocker. And the anesthesia I had was a spinal anesthetic on top of general anesthetic. So that day of 24 hours after, I was actually feeling pretty good as far as the pain level. At about the 24-hour post-op, though, I did have indescribable, whatever that word is, amount of pain. It was probably one of the most painful things I had ever experienced. To be honest, I can't believe they send people home in that type, knowing they'll be in that type of pain 24 hours later. So anyways, a lot of pain at the 24-hour mark post-op. So they increased my hydrocodone and told me I need to be taking it more. And then they ended up switching me from hydrocodone to oxy, so it was a stronger pain medication. However, between the anesthesia and constantly taking pain meds, I started getting sick. So I couldn't keep anything down for about 3 days after that. So I was constantly getting sick. So between the pain and getting sick, directly after, the first 3 or 4 days after were truly awful. And then about Monday, so 4 or 5, I had on Wednesday, so Monday after is really when I started to at least feel a little bit normal. I wasn't getting sick anymore. I'm still in quite a bit of pain, however, it feels manageable with the oxy that I'm on. I would highly suggest that if you're getting this surgery, to really advocate for a stronger pain medicine. I read that they usually send you home on hydrocodone just because it's a good pain medicine, but it's not as addictive as oxy. However, oxy is a lot stronger and it's probably made for this type of surgery. So I would definitely suggest advocating for a stronger pain medicine, at least for the week directly after. I feel like if I had been put on the correct pain medication, rather than loading me up on hydrocodone every 2 to 3 hours, 2 pills every 2 to 3 hours, it probably wouldn't have caused my stomach issues which then caused the snowball effect of me getting sick for about 3 days after. So anyways, that is my pain scale post-op, how I was feeling with the pain medication and just getting sick. Now I'm, 7 days eight days post-op, and I'm in what's called the CPM. So it's called the continuous passive motion machine. So it just bends my knee for me. I'm in this for 6 hours a day right now. I'm at a 20-degree angle is the max amount that I can bend my leg. So I'm in this machine 6 hours of the day. For me, I personally can't sleep in this. It's not extremely comfortable to, go to sleep in, but I have heard some people can sleep in this machine. Just for me specifically, I can't. And then when I'm not in this machine, I am in a leg brace that actually has me locked at a, 100% flex or 0% angle. So it's just locked straight in a brace for the remainder part of, the remainder of my day. I do, get out of the brace and give my leg an opportunity to just have nothing on it, which actually does feel really nice. But I can't bend my leg. So if I ever have to go to the bathroom or not walk, but go to a different room, I always put that brace on just to make sure my knee is protected and I'm not bending it. And then the last thing was a shower. So I took a shower yesterday for the first time in a week. Just with the pain and getting sick, it was just, to be honest, it wasn't really an option for me to take a shower safely. But I took one yesterday. You do have to wrap your leg, because you have that brace on, in a garbage bag, and so you can't get the incision wet. And obviously I have a brace on and I can't get my brace wet. So I just wrapped it in a garbage bag and took a shower yesterday for the first time, which actually felt amazing. I didn't realize how much I loved showers. So anyways, I hope that this helps, someone post-op of expectations after the MACI surgery. I'll probably post, at least, for the time being, once a week, just my progress and what it looks like post-op. And I really hope that this helps someone just kind of understand those expectations directly after a MACI surgery. So if you're getting it, good luck. And, in the long run, I think it'll be for the best. So